We've come to talk with the Chief of Public Health about the Norovirus that's doing the rounds. I mean, you put out another warning today, back to school of course, and it continues. I mean, I think people must be kind of interested in the fact that did we never have this before, or why suddenly this year it's become such more of a hindrance to so many people?
I mean, every year around the autumn winter time we get outbreaks of norovirus, but this year the virus seems to be a lot more virulent and easily transmissible, that the level of activity this year has been a lot greater than in previous years. And the problem with norovirus is that it spreads very rapidly, especially in semi-closed institutions such as hospitals, schools and care homes. And if it becomes widespread, both in case of schools, both the school children as well as staff get affected, and in the past it has led to school closures. That's exactly what we want to avoid, having to close schools, because if you close the schools it creates major inconvenience for parents, and it disrupts the routine.
Is this passed on just like the handshake, the sneeze? That's sort of where the flu would be passed on, is it?
No, it's more through it's a virus which gets into the gastrointestinal system. So I mean, it can be passed through hands, and not only hands, but if you have visited the toilet and if your hands are contaminated and you've touched a door handle and somebody else comes along and touches the door handle, they can get it. And the infectious dose of the virus is very, very small. It's estimated that it only takes 10 viral particles to cause infection. And so for comparison, a cubic millimeter of the vomitus will contain millions of viruses. So it's so easily transmissible.
Now, in the past, you've warned people about not going to A&E with this, because that obviously will increase the chance of being spread. Are people heeding your message?
Yes. We had a few instances where people turned up at A&E with what was clearly norovirus, and we put out statements from the Department of Health, and I must thank the Manx people for listening to us and not attending A&E, not only A&E but also GP surgery as well as the minor injuries unit at Ramsey Cottage Hospital. So they have in general been very good, and thank you again, and may it continue.
So what should they do?
If they get diarrhea and or vomiting, this year's virus seems to be particularly problematic in causing severe vomiting. That seems to be the first symptom. Sudden onset, without any warning. You're fine 1 minute, next minute you're being very, very sick. If that happens, it's most likely to be norovirus, in which case basically stay at home. If it is a child, please don't send the child to school. And if you're affected, and stay away from your workplace, because you might feel like going back to work because you think that work is essential and you have to go back, but then please remember, you could bring the whole office down.
Personal hygiene, is this the cure? Or the rate is keep away from it?
Absolutely. Personal hygiene is very important. Thoroughly washing the hands, and any vomitus or any diarrheal stools, wash the bowl with bleach to kill off all the viruses. And the most important thing is, do not visit either accident and emergency or your GP surgery. I mean, you don't need majority of the people. Let's face it, 99% of the people who get norovirus do not need any form of medical treatment. But say if the virus seems to continue for 3-4 days and you're worried, you may need medical advice. Or the other group is people who have got other problems with them, other underlying medical problems.
Has it peaked now, do you think?
Or? We don't know. I mean, usually what we see is when the schools are shut, the rates go down. And when the schools open, the rates start going up. And what we are trying to do, that's why we circulated a letter to all the parents of all children, and we're trying our best to prevent that going up. Usually the first week is okay, but when the schools open, the second week onwards, second and third weeks are the worst. So we'll need to wait and see. I sincerely hope that following the communications which have been sent by the Department of Education and Children, parents will sort of follow the advice so that we wouldn't get a peak. And even more important, I hope we don't have to start closing schools, because that's the problem. We have had, in the past, we had to close some schools because it's not only children who are affected, but large number of staff are affected. So, it becomes very difficult for the school to continue.
So the danger time is this actual week, this first week back?
Yeah, today is the first day back after the break. So this week we wouldn't see much problem, but the real transmission and the peaks are around the second and third weeks. So we'll need to wait and see, but I hope it wouldn't happen.